TTC for 11 months. All tests are normal. Hubby is fine. So semen, he had a semen analysis. So remember when your doctor is doing the test for fertility, they don't have that many. They look at your ovaries. Okay, ovaries are fine. They look at your cycle day 3 labs. They make sure your tubes are open. They make sure there's sperm. That's maybe they check your progesterone cycle day 3 labs. Apart from that, then they're like, everything's fine. But there are so many, there's at least 50 factors that are correlated with either being more fertile or less fertile. They're not causes of infertility, but like if you have less than 4 days of bleeding, soaking a tampon or a pad about every 4 hours this is what we want. 4 days of bleeding, soak a tampon or a pad every 4 hours, no cramping or clotting. If you don't have that, it may be harder to have successful implantation. If you're really tired, it might be harder to have enough resources for the follicles to develop correctly. If your temperatures don't get above 98, you're not likely making enough progesterone to get or stay pregnant. So that's like 3 out of 50 things that we look at when we're interviewing you in the app. I don't like Band-Aids because if I boost the lining, but I don't fix why there isn't enough lining, when it comes time to double your blood volume, to make a placenta, all the things that demand a lot of blood, you may not have it. So what I prefer to do is investigate, figure out why is there so little blood, and then fix that. That's either related to what you're eating, how well you're breaking it down, digesting it, how stressed you are, because if you're over-exercising, there's something that's going on that is producing the side effect of scanty bleeding. I would try to fix that. Supplement-wise, high-quality natural vitamin E. We have one at Conceivable and L-Arginine. If you're using our app, that's what she'll recommend. But in addition to that, my guess is there are probably diet issues, gut issues, and digestive issues, and potentially stress and exercise issues that also need to get handled so that we get the whole thing fixed. Y'all, I know that sometimes this can feel overwhelming, but the reality is that the job of the app is to make it as easily as humanly possible. And the worst thing that's going to happen from using this app is you're going to have more energy, you're going to sleep better, you're going to know how to cope with stress, you're going to feel better, you're going to communicate better because you're going to do like daily therapy with her. All of these things are wins, and they are preparation for your path to parenthood. Try to get off, I know that's easy for me to say, my kids are in their 20s, but try to get off the pregnancy focus and get on the focus of like, how do I prepare to be the healthiest mom for my baby, both when I'm pregnant, when I'm delivering, and when I'm postpartum.